my name is Megpreet Kaur. My student ID is 1120232221 and I'm here to perform the procedure of sterile wound dressing change. Hi, good morning.
Good morning.
My name is Megpreet Kaur. I'm going to be a nurse for today. Can I check your ID band? Can you tell me your name and your date of birth? Okay, so I've reviewed your treatment chart and the physician has ordered the change of the wound dressing. So basically I'm going to remove the old dressing, clean the wound and then replace it with the new sterile one. Do you consent to the procedure?
Yes.
Okay, before beginning the procedure I'm going to ask you some questions. Are you comfortable in this position?
Yes.
Do you have any pain?
Yes.
Can you rate it on a scale of 0 to 10 with 0 being no pain and 10 being the most pain?
It's 3.
Okay. Do you have any allergies?
No.
So I've assessed the comfort level and done the pain assessment. The patient is comfortable in the position as is. Patient reported some pain, rated it as 3 on the pain scale. As it is a mild pain, so I'm not going to administer any kind of pain medication or anesthesia prior to the dressing change, and the patient reported no allergies. So before beginning the procedure, I'm going to reposition the patient. I'm going to raise your bed, okay? Can you move a little towards me? Providing privacy to the patient. So I've gathered all my supplies that I need on a clean area, and also I have maintained the sterile triangle with my sterile kit on a clean area first, then my patient or the wound, and then the discard area. So now I'm going to start with the procedure. Performing hand hygiene, putting on clean gloves. I'm going to spread a sheet to prevent any swelling. Can you put your arm up to prevent any swelling on the patient's bed? So now I'm going to expose the patient, and then I'm going to remove the dressing. So there is a small amount of serous fluid that can be seen on the dressing, and the wound is not yet dry, so a small amount of serous fluid is normal, and there are no signs of blood. Ideally I have to discard the abdominal pad, but since I have only one abdominal pad, so I'm going to reuse it as a sterile one later on. So talking about the wound, so first of all I will only pretend that it is just a single wound here. This wound is not present here. So the location of the wound is in the upper quadrant of the abdomen, 1 inch above the umbilicus midline. And to check the length of the wound, I'm going to use this scale, and I'm not going to touch it with the skin. So the length of the wound is approximately 7 centimeters. The edges of the wound are well approximated. It is a surgical wound with the primary closure using sutures. There is mild redness around the edges, so there is mild arrhythmia. I'm going to palpate for pain or edema. I'm going to palpate your wound. Let me know if there's any pain.
Yes, here.
Okay. So on palpation, the patient reported some pain, but there is no palpable edema present. So now I'm going to remove the gloves. Perform hand hygiene. Put on clean gloves. I've already maintained the sterile triangle as mentioned before. So now I'm going to open the kit away from me. So throughout the procedure, I'm going to maintain a 5 centimeter clean border, and inside the 5 centimeter clean border, the area will be sterile. So with the sterile tip, I'm going to manipulate the kit. So I manipulated the kit to maintain the sterility of the tip. I'm going to put the tip uh, inside the sterile area, avoiding the 5 centimeter border. So now I'm going to pour normal saline into the tray, keeping it away from the tray to maintain sterility. Also, as mentioned before, I will reuse the pad. So I will open the packet in a sterile field and put it here prior to starting the procedure. So now I'm going to start cleaning the wound. Taking a gauze, dipping it in normal saline and squeezing it. So the technique I'll follow is from the least contaminated area to the most contaminated area for the cleaning. So the least contaminated area here is the suture wound. So I'm going to start cleaning it from head to toe in one stroke and discard the gauze piece. I'm going to take another gauze piece, dipping it in normal saline and squeezing it. I'm going to clean the area that is away from me, head to toe in one stroke and discarding it. Then I'm going to take another gauze piece, dipping it in normal saline, squeezing it, and then I'm going to clean the area that is proximal to me or near or towards me in one stroke, head to toe, and discarding it. Now after cleaning the wound with normal saline, I'm going to pat dry, taking a gauze. So same technique, least contaminated area to most contaminated area for pad drying. So the least contaminated area is the suture line. I'm going to pad dry it head to toe in one stroke, discard, taking another gauze piece, then I'm going to clean the area that is away from me, pad drying in one stroke, head to toe, taking another dry gauze, cleaning the area that is towards me, head to toe in one stroke and discarding it. I'm going to place a gauze piece, okay. So since I have already placed the sterile pad inside the sterile field, so I'm going to pick it up with the sterile. So I'm assuming I've picked this piece from the sterile field and putting it on the wound. So I'm going to discard these later on in the charge container. For now, the tip is sterile, so I'm going to put the tip inside the sterile field. So now I'm going to secure with tapes, removing the gloves, performing hand hygiene. Now I'm going to note the date and time of the dressing. So now I've completed redressing the wound. So after that, I'm going to document my findings. So it was a suture wound that was primarily closed. It was a surgical wound primarily closed with sutures. The location was upper abdomen, upper quadrant of the abdomen, 1 inch above the umbilicus, midline. The length was approximately 7 centimeters. There was mild arrhythmias, mild pain, but no palpable edema that was present, and the patient well tolerated the procedure. Then I'm going to reposition the patient to the lowest position, and I'm going to provide a call bell to the patient. After that, I'm going to document all my findings as mentioned before. And then I'm going to discard all the replace the supplies and also discard the ones that needed to be according to the hospital policy. So this was my sterile dressing video. Thank you.